Why does this happen? This is one of the reasons that has been discovered for it. It's very difficult. I've seen patients who, after a severe neck twist or break, are left paralyzed on the spot, unable to move their arms and legs. Even though we see so many patients, each patient is always new to us, or rather, the reasons behind each patient's condition are different. Welcome to Marian Ayurveda. In this episode, we are reflecting on Discover. As you know, in our hospital, it's said that about 50% of our patients come due to issues related to Discover. But even though we see so many patients, each one is always new to us, or the causes for each patient are different. So no matter how much experience we have, we must treat every patient as if we are seeing them for the first time. Only then can we provide them with the relief or cure they are seeking for their illness. I am Dr. Anumod Kakkassery, Marian Ayurveda, Thrissur. Now with me here is a mother named Leelamani. Where in Palakkad was your home?
Manduthi, JK area.
Manduthi, right? Okay. What all difficulties did you have when you came here?
I had persistent neck pain, dizziness, and I couldn't even chew my food.
And you couldn't chew, right? What other difficulties did you have? You used to mention them when lying down.
I couldn't lie down on my side.
So tell me, you couldn't lie on your side at all. You had to lie completely flat on your back, right? And what about when you had to travel somewhere?
After traveling, it would be the same.
You had to lie down like that.
I was never particularly fond of the idea of traveling.
You didn't like it, right? Because of this pain. When we look at the MRI, we can see it's such a severe bulge, not like what we usually see in ordinary people. It's hard to even imagine. That's how bad the complaint was. There was a disc bulge in your neck, right? How is it now?
Now I can chew.
Now I'm able to chew.
I can lie down.
Now I can lie down on my side.
And now, when I walked here, the dizziness has reduced. I didn't walk that much in this room, right?
Okay.
So the dizziness has reduced, and I feel a bit of relief.
It feels like relief, but not completely, you know. Okay, and then...
It was only after about 10 full days had passed that I began to notice some significant changes, and those changes continued to unfold gradually over time.
Okay, yes, that's right. Now, even during the treatment itself, we get about 70 to 80% or even up to 90% results. After the treatment, even when we are at rest, things are much better now. Still, it's not like everything is perfect. We get a sense of confidence, and that's an experience everyone has. The healing process continues for about 1 or 2 months, so in any case, you will definitely get better. But it won't be exactly like before. This is the first time we're getting such treatment for a problem we've had since childhood, right?
When we first came here, we didn't really have much hope at all. But after coming here and beginning the specialized medical treatment, within just 4 or 5 days, we began to notice significant and positive improvements. After about 10 days of care, we fully realized that a recovery was actually possible even without undergoing any surgery.
We could be saved.
Now, the two of us feel a deep sense of happiness, and we are truly grateful that we were able to be saved.
During the treatment, we were told not to touch the neck at all, not to apply any pressure, and not to do anything else. The treatment itself would allow the disc to move back on its own and correct itself. We saw that in the video.
Indeed, yes, we certainly saw it with our own eyes. That is to say, for about 3 inches, that specific nerve was completely missing.
No.
So they said.
That's me.
But now, after coming here, that nerve has reappeared.
That's me.
The nerve has become clear.
It started functioning. That's why now I'm able to turn my neck and all.
We are going back extremely satisfied and happy.
Now you can eat, you can chew, right?
In the beginning of this journey, my wife couldn't chew at all while eating. But now that's completely changed for the better. Now she can eat just about anything that is put in front of her. But we still know that we shouldn't give her anything that is excessively tough or difficult for her to chew.
Yes.
That's how we are moving forward now, and we are moving forward with a lot of happiness, but we never expected it would be this good.
Yes, it's God's blessing. All of this is an added blessing from God.
Sir, as we discussed earlier, I have 90% faith and you have 10% faith in God. If both of these come together, then it's okay. That's what you said, and that's what made us happy.
If you look at the patient we just saw, Leelamani, you can see that there are a lot of dark patches or lumps around her neck. When this patient first came in, what caught my attention was these lump-like conditions on her neck. Why did this happen? This is the reason that has been discovered for her condition. According to her history, even though we didn't mention it in the testimony just now, I have written it down here in my records. From childhood itself, when she was in 5th, 7th, or even 8th grade after coming back from school, this mother had to lie down immediately. If she came home at 4 o'clock, she would lie down for 1 or 2 hours before doing any other activities. Even now, As an adult, after traveling, she has to lie down. She doesn't know why that is. It was just considered a child's habit. The reason for this, as stated, is that she has had a disc bulge problem since childhood. Even after a short trip, she would experience disc compression and would need to lie down. So from a young age, she has had a disc bulge problem. On top of that, she had severe indigestion, meaning none of the food she ate was getting digested. If the food isn't digested, the necessary portion doesn't reach the disc. If the disc doesn't get its portion, it dries out and the disc will automatically keep pushing out. So when she came here, the first thing we noticed was that she had severe gas issues. If it doesn't get digested, as we know, when we put waste into a biogas plant, gas will build up and swell. In the same way, after she ate food, gas would build up and her stomach would bloat. The first thing we did was address her stomach gas problem, or in other words, the issue with her digestion. Otherwise, she would get a disc bulge again. So that's why in the first stage itself, we fixed her stomach. As mentioned earlier, she had a severe disc bulge. It's very rare to see such a large disc bulge. Just as her husband mentioned earlier, there was nothing visible of the nerve or spinal cord in that area of the disc. It was completely blank. That's how much of a block there was. Because of this, she couldn't even make the slightest movement or shake. Otherwise, even a slight movement of the neck, like turning it while lying down, was impossible. She couldn't eat much food. She couldn't even chew and swallow properly. It was such a difficult condition to be in. As I mentioned earlier, now she has experienced 100% improvement in mobility. So now, there are no more problems. If this same treatment is needed again, it can be repeated after a year. Now, such a problem like a disc bulge is unlikely to cause any major issues for this person anymore. As I always say, the specialty of our treatment is that in the neck area, we never apply any force or use any scraping or anything like that. Not even the slightest pressure is applied there, except for the gentle pressure of a little oil. That is, we never use such hand techniques. In fact, I am often shocked when I see such videos. They grab the neck and twist it this way and that. If you do that to this patient right on the spot, both their hands and legs could become paralyzed and they could end up bedridden. So that's why we always instruct the therapists and junior doctors here about this. The main thing is, under no circumstances should you touch the neck. These are patients who can't even withstand the slightest pressure. So often when I see this in videos, people are really happy cracking their necks like that. For those with only minor issues, it might not be a problem. But for those with serious problems, if they try to crack or twist their neck, they could end up paralyzed in both hands and legs on the spot. I've seen such patients myself. So based on that, what I'm saying is, if you have a disc bulge in your neck, you should never try to crack your neck or stand in such positions. It's dangerous. So, as I mentioned earlier, if you want to treat this scientifically, you need to ask why the disc isn't getting enough nutrition. It is the stomach or abdominal issues that are preventing nutrition from reaching the disc, and that is what we address there. Through the treatment we do there, nutrition is absorbed directly into the disc bulge, mainly through oil absorption. That is, we simply pour specially prepared oil at a specific temperature onto the area. By pouring the oil in this way, absorption into the disc increases. Through this process, the disc gets flushed out. The hardness of the disc is reduced, making it softer. As a result, it becomes easier for the nerves to travel to the hand, head, and ears. We will meet again in another episode. Thank you.